Hello, everyone. It's Tuesday, June the 1st. You know, time just marches on, does it not? You know, it's been a long time for a lot of folks, and a lot of sadness because we've lost in excess of 2,700 and right at 2,800 people in West Virginia. But we're getting through this, and testimony of this today is just this. You know, we haven't been together since last Thursday. Now, we hate losing one person. I mean, that's for absolute certain. But we've lost five people since last Thursday. You know, that is amazingly better. But at the same time, it's still tragic for these families. And so please, show them all your respects. Absolutely. If you have the chance to know, if you happen to know these families and these people, please take time to at least give them a call. And if not, please keep them in your prayers. The 2,793rd death is a 78-year-old female from Randolph County. The 2,794th death is a 92-year-old female from Pleasants County. The 2,795th death is a 78-year-old female from Wirt County. The 2,796th death is a 45-year-old male from Kanawha County. And the 2,797th death in West Virginia is a 65-year-old female from Kanawha County. Again, I say it over and over and over. Don't let them become a number. Don't let them just be a statistic. Absolutely, keep these folks in your prayers and know that they've given so much to so many, especially wisdom to all of our folks, and we'll miss them. We'll really miss them. 2,797 that we've lost now. Absolutely, please keep them in your prayers. Our new positive cases in the last 24 hours were 571 new positive cases. Our daily positivity rate is 4.00%. We tested a lot through this time period. Our cumulative percent of positive cases in West Virginia is 5.09. That continues to drop, and that's really good. Our active cases, now get this number. This is great news. Our active cases are 4,550 cases in West Virginia. That's the lowest that it's been since October the 27th, 2020. Our recovered cases are 154,511. We have 207 people that are hospitalized in West Virginia, and 81 of them are in the ICU units. And Boone County is a county that is in the red. It's the only county in red right now. I remind you over and over, if you're 65 years of age or older and you feel the least bit bad, please go get a test. It's simple as it can be, and it could very well save your life. If we catch this early enough, the antibodies will shut it down. But we got to be able to catch it early enough, or you're going to be in for a real struggle. Now, you know, as far as vaccine eligibility, it's 12 and up. Anybody in our state that's 12 years old and older is vaccine eligible. Now, there's some milestones that I want to tell you about today that I'm really proud of. You know, we said we're going to try to get to 85% of all those that are 65 years of age and older that absolutely are vaccinated. Now, get this. We also said we were going to try to get to 75% by June the 20th of all those folks that are 50 years of age or older. Today, we reached that goal. Today, on June 1st, we have well in excess of 75% of our people that are 50 years of age or older that have received the first shot. And that is wonderful news. Also, today, we also hit 84% of our 65 years of age and older. And so we're 1% away from a lofty goal to have 85% of our folks vaccinated that are 65 years of age and older. Now, and again, I'm not slighting anyone here at all, but these are things that we should report, and these are things that we should flaunt from the standpoint of how West Virginia is doing. In the month of April, we came in, I think, at $1.8 million on a surplus, and we moved the income tax filing date until May 15th, I think. Now get this. Through April, I think we had a surplus of around 239 or $237 million. I am announcing to you right now that the May revenue surplus, the May collections came in with a surplus in the month of May for 1 month of $152.2 million. Now, our year-to-date collections are reporting a surplus of $389,600,000. I am telling you, we should all be so proud of how West Virginia is minding its store. Absolutely. Through our bond rating agencies to on and on and on. This is so profound, and it absolutely should be our number one thing that we're carrying through the streets and reporting the health and goodness of what's going on in West Virginia. It's good stuff. It's really, really good stuff. Now, as I promised you last Thursday, that I would announce a new vaccination incentive lottery program. You know, now I've told you that we're going to give away prizes and things like that, and you hate really if you just step back and think, well, why in the world would you have to give away something to get somebody vaccinated? Well, unfortunately, it's the way of the world in a lot of situations. We had people run and beg to be able to get their vaccination. I would tell you throughout countries all across this globe, especially India today, people are begging to have the ability to get vaccinated. You know, so in all things and everything, maybe we shouldn't, have to give away things to get people across the finish line, but just think about this. The faster we get them across the finish line, the more lives we save. Absolutely, that's all there is to it. It's just as simple as just that. The faster we get them across the finish line, the more money we save as a state, and absolutely these dollars become not minuscule because these are real dollars that we're giving away, but absolutely at the end of the day, if the tab just keeps running, the cost is enormous. The testing cost is enormous. The hospitalizations are enormous. The deaths are really, really bad. And so we got to get all of our folks across the finish line. And I did something, just kind of in jest, but at the same time, really and truly, the good Lord gave you the ability to smile and to laugh. And through all this, it's tough. It's been really tough. And we need to be able to smile and laugh. I brought Baby Dog the last go-round. And I said, if you won't do it for me, you won't do it for your family, do it for Baby Dog. Oh, gosh, I didn't see that picture. But nevertheless, they just flashed that up and everything. I just saw it when you saw it. But anyway, she's my buddy. And absolutely, I would say, if you can't do it for yourself and you can't do it for your family, do it for Baby Dog. Do it with a smile on your face. Please get vaccinated. Now get this. Here's what we're going to start with giving away. We're going to do this program from June the 20th until August the 4th. Now, and we're going to start with our birthday, which is Father's Day, and we're going to start with the giveaways on Father's Day. Now, here's what we're going to do. And then we're going to continue on through this pace until Wednesday, August the 4th. And at that point in time, kids will be going back to school and everything, and we need to get across this finish line by then. We're going to continue on, with this program until August the 4th. We're going to do it once a week, but on Father's Day, here's what we're going to give away on Father's Day. Before I say this, I want to tell you just this. To be eligible, you have got to get your first shot. And absolutely, I tell people over and over, when I start through these prizes, really and truly, what's going to happen is there's going to be a run on people getting their first shot. So go get them. Go get them so you'll be eligible, where we could draw your name, and absolutely, you could win something that would be phenomenal. But with all of that, you've got to get your first shot. You've got to get vaccinated and get your first shot. So with that, let me just tell you what we're going to give away on Father's Day. We're going to give away 2 full 4-year scholarships to kids that are age eligible from 12 to 25. So of the 12 to 25-year-olds, we're going to give away 2 full 4-year scholarships to any institution in West Virginia. We're also going to give away 2 brand new custom outfitted trucks. And there you see it. We're going to give 2 of them. I think they're called Rocky Ridge, and they're specifically outfitted, and we're going to give 2 of them away. On Father's Day, we're going to give 25 weekend getaways to our state parks on Father's Day. We're going to give 5 lifetime hunting and fishing licenses giveaway on Father's Day. That's my little bird dog, Jazz, that's right there. Now Jazz is older now, and she's, bless her heart, she's lost her eyesight and everything, but what an incredible, wonderful little dog, and everything. But we're going to give 5 custom hunting rifles and 5 custom hunting shotguns away on Father's Day. And also on Father's Day, we're going to make one of you a millionaire. We're going to give away $1 million to somebody on Father's Day. That's it. And then we're going to continue that right along. Absolutely. And this is for all people that have been vaccinated. If you got vaccinated back in the end of December or the beginning of January, absolutely you're eligible. Every West Virginian that is totally eligible for this drawing. So I said it before, but I can't stand for Ohio to get ahead of us on anything, and you've got to remember that you're not eligible. You're not eligible unless you get your first shot, your first vaccination. And remember Johnson & Johnson, you only have to take it once. And remember Pfizer and Moderna, you have to take 2 vaccinations. But if you have your first one, you're eligible. So we're going to, we're working today on creating a website where you will be able to register for the prizes, and you must register to be eligible to win. And the last thing, and Nathan came up with this saying, and I love it, save a life and change your life. So nevertheless, the more we can get vaccinated, the faster we'll get to saving all kinds of different additional lives and saving lots and lots and lots of money to the state of West Virginia. Again, I'm calling especially for our kids. I was working on 16 to 35. Now I'm working on 12 to 35. I encourage all the parents and grandparents to help us get them across the finish line. For those 16 to 35, they'll be receiving either a gift card or a savings bond at their option for $100. And we need to keep on pouring it on there to try to get them vaccinated. We're at 84.2% of the total administration for first and second doses. Those that are, as I've reported, of age 65 and older, we're above 84% in first dose. That's great. We're of the 50 and older, we're in excess of 75% at first dose. That's wonderful. Half of our population in the state of West Virginia is now fully vaccinated. And of all those eligible, age 12 and above, and this number keeps moving just the way we want it to. Now we're at 58.7% that have received the first shot. We jumped a whole percent since the last time I was with you and everything. That's great. We've continued to vaccinate people at our state parks, and I've got to report this. Last week, the Pilgrim's Pride operations in West Virginia, those people do great work with grain and everything, and supplying, our poultry industry and everything. But get this, they had a vaccination clinic at the Pilgrim's Pride operations, and they vaccinated 800 of their employees there. Great stuff. Thomas Hospital now has vaccinated 93% of their employees, and this week we'll be giving vaccines as a part of the food bank effort in Gilmer County. So all good stuff. Encourage you over and over and over to if any type of business that you may be, or any type of organization, church especially, if you want us to come and do your congregation, if you want us to come and do your employees at a business, just give us a call. All you got to do is call right there. We'll set it up and we'll come running. Our vaccine info line is all up there and everything. Our call to arms, that we absolutely are looking to call to arms to get those shots in people's arms and everything. We've set that our state birthday on June 20th, the masks are gone for all of us. The masks are gone right now for all of you that are fully vaccinated, and then have 2 weeks after that, then you're in great shape and good to go without a mask today. You have to have the 2 weeks after the second shot if you're on Moderna or Pfizer, 2 weeks after the first shot of Johnson & Johnson, and then you're good to go. And you got to remember all along that our private businesses still have the right to require masks and everything. That's their right as a private business. I encourage you about the free testing, to get tested. Our map is up there and everything. Absolutely get tested. I thank Frith and Walgreens so much for all that they've done with the drive-through testing. We have 11 outbreaks today in our long-term care facilities, 6 in our churches in 4 counties. That's Monroe, Webster, Taylor, and Nicholas County. We have 6 inmate cases in corrections and 10 staff cases. A phenomenal job, beyond belief, beyond belief. We want to remind our churches and our long-term care facilities to keep pouring it on and keep absolutely just working hard to get this number to 0. You've done great, though. I'm really proud of you. You've done really good. I ask all the people out there, especially those that have had this dreaded killer and everything and gotten over it and everything, to really consider giving blood. We need it. We absolutely need it. And I always believe that the giver is always the one that wins. And so just continue to think about that. And if you can give blood, it's really, 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 really helpful. I want to go back and mention Mark Curtis before, because I loved it, when Mark Curtis stepped up, and he's trying to help. He's trying to help in every way. When he mentions that at St. Albans down here at the First Presbyterian Church in St. Albans on June the 4th, they're going to hold a clinic there. They're going to give shots to anyone that comes and everything. Any West Virginian that's 12 years old and older, will get a free shot, a free vaccination and everything. And the first 300 customers that come in there and get vaccinated will get a $20 gift card to use at any of the St. Albans businesses. Now get this. In addition to that, they'll get for the 12 to 30, I'm sorry, for the 16 to 35 years of age, they'll get a $20 gift card and a $100 either savings bond or gift card. And everybody else, everybody that is going in there and getting vaccinated will be eligible for all these prizes. The bottom line is to win, and with the big prize being, they'll be eligible to win $1 million. Now just think about it. If you go to St. Albans and you're vaccinated, on that day you're going to get a $20 gift card. If you're 16 to 35, you're going to get a $100 gift card. And honestly, on top of that, you're going to be eligible to win $1 million. I mean, come on. Mark Curtis stepped up. You need to step up and do the same. And the only last thing that I've got is just reporting an incredible traffic count and everything. But on Memorial Day weekend, on the West Virginia Turnpike was up 45% versus last year on the 2020 levels. So over Memorial Day weekend, lots of folks out, a lot of people moving around and everything. Even though the gas prices are through the roof, you know, we still got a lot of folks that have been cooped up for a long time and they want to get out and they want to go. And that's great stuff and everything. So that's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. So the governor delivered a lot of really good news, and we have much to be proud of in West Virginia and even more to be thankful for. Just a real quick appreciation to all of our military personnel. Memorial Day is a very meaningful and sacred day that reminds us of how much many have sacrificed so that we can enjoy our freedoms and liberties. And for that, we are all eternally grateful. When we look at COVID-19 around the country, we saw the lowest number of cases around the country than we had perhaps since the very beginning of the pandemic. There were 5,602 new cases that were documented overnight. And as the governor said, we have much to be thankful for in West Virginia. We have reached the 75% mark for first doses in our over 50-year-old population. We have reached the 84% mark first doses in our over 65-year-old population. And remember, over 97% of our deaths have been in West Virginians 50 and older. So we want to really encourage all those folks to continue to get your second vaccine. We're seeing in countries where people don't get their second vaccine, as is programmed by the Food and Drug Administration, 21 days for your second dose of Pfizer, 28 days for your second dose of Moderna, and the one dose of Johnson & Johnson, as the governor said. And we know 2 weeks after your final dose is where you have your maximal protection. And with that protection, the vaccines are incredibly effective against any variant that we've identified. And as we look at some of our outbreak data recently, we see that any outbreaks in nursing homes, and the governor said that we have had several, I think 14, the people that have gotten ill from being infected in these nursing home outbreaks and have ended up in the hospital or the ICU are all unvaccinated. So when we look at real world experience here in West Virginia as well, we see that being fully vaccinated is incredibly protective against any severe manifestations, hospitalizations, ICU admissions, or death from COVID-19. And to that end, the Food and Drug Administration will likely approve the Moderna vaccine for 12 to 17-year-old Americans, like the Pfizer vaccine. And in the clinical trial involving 3,700 people, the Moderna vaccine was 100% effective in keeping the people fully vaccinated 14 days after the last vaccine, who are 12 to 17 years old, from getting infected with COVID-19. And any side effects were really limited to a sore arm the day after. So these vaccines are incredibly effective. As the governor said, we have many people around the world that are so desperate to get the vaccine. We've seen so much loss of life around the world in India. Now we've seen Peru increase their death count to well over 100,000 and now be the highest country in per capita deaths in the world from COVID-19. So COVID-19 has not stopped. We know that people that are not immunized currently in West Virginia are still susceptible to getting severely ill, to dying, to having long-term side effects of COVID-19. And we know these vaccines are extremely safe and unbelievably effective. And so we encourage every West Virginian who has not been fully vaccinated and is eligible to please choose to get vaccinated. And it's really exciting that the governor has opened up an incredible array of incentives for our citizens who will benefit themselves from getting fully vaccinated, benefit all other West Virginians, because we know that vaccinated people don't spread the virus either, and the virus cannot mutate in people that are fully vaccinated. So for every great reason, it is amazing to celebrate our birthday coming up and see the numbers that we are seeing. We know that in West Virginia, we have had over 23,000 new vaccinations since Friday. Let's keep it up, West Virginia, and let's show the country what happens when we all go first and where we really show folks how to appreciate each other, protect each other, and live in almost heaven. So thank you.
Thank you, Dr. Marsh. Next is Secretary Bill Crouch with the DHHR.
Good morning, everyone. Hope everyone had a great Memorial Day weekend. Following Memorial Day weekend, testing continues to be more important than ever. CDC recommends delaying travel until you're fully vaccinated. According to CDC, fully vaccinated travelers are less likely to contact and spread COVID-19 and can travel at low risk to themselves within the U.S. People not fully vaccinated should get tested 1 to 3 days before domestic travel, and importantly now, 3 to 5 days after travel. If you are experiencing any symptoms, including cough, sore throat, runny nose, fatigue, body aches, or even if you feel like you've been exposed to someone who had these symptoms or might have had COVID, please get tested. We have free testing events available throughout the state. These events are open to all West Virginia residents, including asymptomatic individuals. As the governor says every briefing, please get tested. To find an event near you, visit the local COVID-19 website. Community immunity begins with us all. If you have not been vaccinated, please get vaccinated. Protect yourself and others. Thank you.
Thank you, Secretary. Retired Major General Jim Hoyer and Dr. Ayan Amjad, our state health officer, both had prior engagements today. They will rejoin us on Thursday. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yes, Steve Adams, Ogden Newspapers here. The Wall Street Journal reported yesterday that you personally guaranteed about $700 million in loans to your company, Bluestone, from Greensill Capital in 2018 during the second year of your first term as governor, making Bluestone one of the 3 largest Greensill borrowers. That story just came out yesterday. I was wondering if you had any comments, if you'd seen that story from the Wall Street Journal, if you had anything additional to add in regards to that report. Thank you.
Stephen, I really don't have anything additional to add, but and I have not read the story. I've been, it's been reported to me about the story. Stephen, if you knew all the details, you'd know that evidently Greensill is a bad actor, and in almost in partnership with that, you've got the Credit Suisse people that were tied at the hip with Greensill that we didn't know anything whatsoever about. From the standpoint of what Greensill is done and everything and what they're doing, how in the world could we have ever known anything whatsoever? It's very unfortunate to our companies, and we'll have to get through it. but and I know some people will probably rejoice in the agony of what our companies will have to go through and everything to get through all this. But our companies are good and they've done the right stuff, and so along the way, it's very unfortunate, and and truly it's a pain. That's all there is to it. But I don't know how to report anything else other than just tell you that.
All right, thanks, Stephen. Next to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members. Governor, first of all, thanks for the shout out on Friday's vaccination clinic at First Presbyterian Church in St. Albans, sponsored with the city of St. Albans and the St. Albans Ministry Alliance, which is about a dozen churches. It's going to be a great event. It's getting a lot of publicity, and we certainly appreciate you publicizing it as well. We're trying to do our part. Now to my question. What keeps you folks up at night? And this may be particular for Dr. Marsh. Every now and then the governor talks about this thing whiplashing and backlashing against us. We hear good numbers like we did today, and I wonder about the public getting a false sense of security here and what your big concerns are and where people should not be letting their guard down thinking we're almost in the clear.
Well, Mark, I thank you, and I'll let Dr. Marsh go. But the only thing I would say is the good numbers are driven from the standpoint of we continue to get people vaccinated. One of the notes that I just made just a minute ago, was, from the standpoint of all of our hospitalizations, all of our ICU units, all of our deaths, for the most part, are all people that have not been vaccinated. I don't know how it gets any simpler than that. If absolutely these vaccines are amazingly safe and they'll protect you. I don't know how in the world people are sitting on the sidelines still saying, no, I'm not going to do one. I'm not going to do it. And then of all things, expose themselves to the potential of travel, and they go off and they travel, and then absolutely there's, what I would say a lot of sad singing and slow walking. And that's what goes on at a funeral. And so Mark, I think that at the end of the day, Dr. Marsh can shed a lot more light on it than I can, but at the same time, it's just as evident could possibly be, that we need to get vaccinated. But Dr. Marsh, please take over.
Thank you, Governor. Mark, thank you for your question. I think the governor's really addressed it very, very well. We know that COVID-19 has responded unlike any other infectious disease in our lifetime, from the standpoint of the impact that it created on all of our state, country, and world systems, whether it's economic or social or educational or health. And so we should have learned and should learn to take this disease very seriously. And as we've said the whole time, we've been following the data. So the thing that keeps me up the most, as the governor said, is the fact that we still have a substantial part of our state that has not chosen to be vaccinated. These vaccines are incredibly protective. And they also protect against the disease, the virus mutating and continuing to evolve its defenses and strategies, that the concern is that maybe at some point it will evade some of the benefit of the vaccines that we've done. And so the more we have people vaccinated, the safer it is for those people, for everybody in their communities and families, but also that we keep the virus from mutating. And as we look around the world, we know that there's many countries that have not had the vaccination rates that we are seeing in the United States. So all those things keep me up at night. But at the same time, I'm very, very grateful that we have these vaccines, that so many West Virginians have chosen to be vaccinated. As the governor said, the numbers look better and better and better all the time. So we are very optimistic about that, but we cannot get complacent because this is not over yet. So thank you for your question.
Thank you, Mark. Next to Mark Cram with WDVM.
Good morning, Governor. Good morning to everyone. And nice to be back to work after a holiday weekend. Governor, just a point of clarification. Did you say for the rewards that individuals must register or are they automatically eligible just by virtue of getting the shot? And the second question, with the moving of the tax deadline to May, is that going to impact refunds or the processing of tax returns in any way? Thank you.
I do not think it'll affect the refunds or the processing in any way. And Mark, the other thing is, again, thank you for always being on the call and representing the Eastern Panhandle and everything, and doing all the great stuff that you do up there. But yes, registration will be required to get you into the drawing and everything. And it'll be open later this week and everything. We'll have plenty of time to get you registered and everything. It won't take but a second and everything. Once we get it all in place and everything, it won't take but a second and everything to get you registered and everything to be eligible for the drawing on Father's Day and on our state's birthday on June the 20th.
All right, thank you, Mark. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I know that we're talking about first shots and getting full doses of the vaccine, but I also know that in the background that plans are underway and have been underway for quite some time for booster shots for West Virginians as we enter a second round coming up later this year, maybe around September, October, November. Can we get a quick update on where that is right now and what the target date will be for getting boosters into the arms of West Virginians, because the COVID threat will not be going away, at least foreseeably anytime soon? Thank you.
Kenny and Dr. Marsh, will probably follow me on this, and please do, Doc. But I think whatever the CDC or whatever the medical experts come out with as far as the booster shots, we'll be ready. We'll be ready whenever that is. We'll be ready to go. But Dr. Marsh, maybe you could shed some more light on that. You're the medical expert here.
Thank you, Governor, and thank you, Kenny. Once again, I think the governor's right on target. We are following closely what CDC will recommend, and they are tracking people carefully. We're also watching carefully, as we just discussed, any outbreaks and anybody breaking through the vaccines who are fully vaccinated 2 weeks afterwards, who get infected again with COVID-19, to see if anybody does develop any kind of serious or life threatening problem from that. And so as we watch those, which we're not seeing, CDC has not recommended that, but we anticipate by at least a year from the beginning of the vaccinations, particularly for people that have not been previously infected with COVID. There's some data suggesting if you've been infected with COVID-19 and you've recovered and you've been fully vaccinated, then that immunity might actually last longer. So we're waiting to get specific instructions, but we are already in the planning stages of the booster shots for the state of West Virginia, and we will absolutely be ready whenever CDC guides us to that.
All right, thank you, Kenny. Next, we'll go to David Beard with the Dominion Post.
Hi. Question about the prizes for the vaccination incentive, the $1 million, the truck, the guns, etc. Wondering what kind of federal and state tax liability those prizes will carry, and will the state inform the prize winners about that when they receive the prize, or will they be advised to consult their tax professional? How will that work? Thanks.
Well, David will inform, and I'm sure we'll have a bunch of happy campers and everything, and everything. But we'll give them all the detail and everything.
Thanks, David. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. My question toward Dr. Marsh is about the variants that are out there from India and Vietnam. There's also been some information out there about renaming those variants. Is this just going to get too confusing for everybody? This has been a confusing time as it is. Now renaming variants. What are your feelings about that?
Dr. Marsh.
Sorry, I'm muted. Thank you, Governor. It is maybe a little bit confusing. The World Health Organization is trying to prevent any stigma from being associated with the country of initial origin of the variants. And as we've talked about, our most common form of COVID-19 in West Virginia and in our country is the variant that was initially found in the United Kingdom. The World Health Organization suggests that we call that a variant alpha, as opposed to the United Kingdom variant. And as each new variant was discovered in the world, for instance, the South African variant is thought to be called Beta, the Brazilian variant Gamma, the Indian variant Delta. And I think that those nomenclatures, while I think the intent is good, the Centers for Disease Control have not signed on to that, and we will continue to at least refer to them by their initial country of origin until instructed otherwise by the Centers for Disease Control. And I think as we go forward, and the point you make is so important, that we know that the only time the virus can continue to mutate is when it replicates. Remember, the virus is a messy sort of replicator, and as it continues to grow, it makes a lot of mistakes, and those mistakes are genetic changes. And when those genetic changes give the virus a benefit of having a higher ability to infect us, we call them a variant. And there's new variants that are coming all the time. One, as you said, in Thailand, there's a second variant in India that has caused a bit of an issue in the United Kingdom. And that was really what I was referring to, because in the United Kingdom, a lot of people have their first vaccines, but not as many people are fully vaccinated. And it's clear to get the benefit of the vaccines against some of these new variants, like the Indian variant. We don't know as much about the variant that we're seeing from the Far East from Thailand, but we need both vaccines, and we need folks to be 2 weeks after that. So as we go forward, we will still refer them by the country that they were founded in, but that is really the reason why it is so important for all West Virginians who have not yet chosen to be vaccinated, who are eligible, 12 years old and up, to go ahead and choose to get the vaccine. It not only protects you against getting sick, getting critically ill, or even dying of COVID-19, or developing long-term symptoms of COVID-19, which happens in a substantial part of people that get infected. It also protects you from being a person that could let the virus mutate inside of you and perhaps be even more deadly to others. And it puts you in line for some amazing prizes. And so for all those things considered, and the fact that these vaccines are extremely safe, to me, it is so important that people choose to be vaccinated.
All right, thank you, Paul. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, back on the Wall Street Journal story suggesting that you're personally liable for $700 million. Can you clarify, are you on the hook for $700 million? And if so, why would you personally guarantee these loans if you are no longer involved with your private businesses? Thank you.
Well, from a standpoint, Brad, yes, I did personally guarantee the loans. The loans have always been personally guaranteed. When they flowed from Carter Bank to Green Seal and everything along the way. So that's been there for a long period of time. The very thing that that I think that you've got to remember is just this: we didn't do anything wrong. Green Seal is the one that's the bad actor. We have sued Green Seal. And in addition to that, we're not going to let Green Seal just get by with doing bad stuff. And on top of that, if you'll just step back from it and think about the whole thing, Bluestone, the Russians had Bluestone. And when the Russians had Bluestone, what happened to Bluestone? It absolutely just melted down to nothing. It closed. They left reclamation liabilities like crazy. They absolutely left liabilities to the unions. You know, there were pension obligations to the unions. They left absolute tax liabilities, you know, whether it be to Wyoming County or McDowell County, and they left all kinds of obligations to vendors. And what did we do? We paid them. We paid them. We absolutely took back over and have been rebuilding Bluestone back. And Green Seal was doing the lending. And then Green Seal, out of the clear blue nowhere, out of nowhere whatsoever that we could have ever known in any way, took bankruptcy. Now, it is absolutely a mess, that's for sure. And it is a burden on our family beyond belief. And we'll have to deal with it and everything. But you see, that's something that we'll have to deal with as a family and everything. It's tough. It is really tough. You know, but from the standpoint of what I do and what I do every day, I'm here doing exactly what I do, and I do every day, and I'm very proud to do it. And that's what I'm going to continue to do. I'm going to be your governor.
All right, thanks, Brad. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know you said there are plans to do one drawing a week between June 20th and August 4th. But just to clarify, is the plan to actually give away $1 million each week? Will there be $1 million given away at each drawing? And then if you could detail, I asked a little bit about this last week, but where are the rest of these prizes coming from? The trucks and the shotguns? Is the state purchasing them outright? Are they being donated by someone? Thank you.
No, Charles, we'll purchase them outright, and from the standpoint of the $1 million, it's $1 million a week. We're going to give away $1 million every week with the grand prize at the end. Remember the 588 beat 588 ... bad. The grand prize that we're going to give away, we're going to give 2 of them away. The last one's on August the 4th. We're going to give away $1,588,000 as the grand prize. And the runner-up prize, we're going to give away $588,000 on August the 4th.
All right, thanks, Charles. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Couldn't get unmuted for some reason. Governor, to follow up on the previous questions, you say Green Seal was a bad actor, but according to Bloomberg, Bluestone had been doing receivables financing with Green Seal for an extended period of time, obviously to accrue $700 million in loan debt. So at what point did it become obvious to you all that Green Seal was a bad actor in all this?
Phil, what we were doing, was just this, and of course I've had to surely review this with my family, but what was going on was the rebuilding of Bluestone, and we knew it would take hundreds and hundreds of millions of dollars to rebuild Bluestone from the mess that the Russians had left it in. Everybody knew, the magnitude of what you were doing because it's a big company. It's a great big company. So as we were moving forward with doing that, and we were, moving forward with doing that every day and that's my family. That's what they do, and I'm very, very proud of my son from the standpoint that he's done a great job in regard to that. But truly, Phil, this was hard to imagine, but the Green Seal people came in and met and 2 days later and talked to us about how great everything was going and everything just wonderful and all that. And then, in their discussions with my son about how great everything was going and how pleased they were with all the progress that my son had made and Bluestone had made. And then 2 days later, they declared bankruptcy. I mean, Phil, Jiminy Christmas. You'll see as time goes forward, and from a standpoint of our private businesses and so on like that, we'll continue to do exactly what we've done in the past, and that is we'll continue to pay our obligations and move forward. But this one is a bad actor that got caught, to tell you the truth. and we didn't have one earthly clue. And you know, and that'll all come out as we go forward. But it is terribly unfortunate, and it's something that our family has to deal with. And you know, I know that from the standpoint of, you know, those in the media, they love to throw rocks and everything, but you know, I'm going to go on about being the governor. I hate to say it this way, but I'm not going to pay one bit of attention to it. You know, we'll get through this, and hopefully things will even be better, you know, after with the end result.
All right, Governor, I'll turn it back to you.
I don't really have anything else. I would like to just reiterate one thing, and that is from the standpoint of, if you just, everyone would focus back on Dr. Marsh and his words, because his words are so profound. When he said that of all the hospitalizations, you know, and I think we've got 200 and some that are hospitalized right now, and 207 that are hospitalized, and 81 of them in the ICU units. Now just think about this. Of those 207 that are hospitalized and 81 in the ICU units, how many would you think have been vaccinated? I think it'd probably be a real rarity if there was one. So if none of those are vaccinated, and of the active cases that we have in West Virginia, 4,550 active cases, how many of those do you think have been vaccinated? Probably the same answer. For all practical purposes, none. Now, if that be the case, and on top of all that, here's a number right here, 2,797 that have died. How many of those do you think have been vaccinated? And that answer is probably zero. Why in the world would you take a chance? Why in the world would you continue to take a chance? Absolutely. There's no way. If 99% of our population were vaccinated, 99% of our population was vaccinated, and I knew that 99% were vaccinated, and I wasn't vaccinated, or my children weren't vaccinated, absolutely, I would be dragging them to get them vaccinated, and myself as well. If 99% of our population was vaccinated, that's what I'd be doing. Because you just don't ever know. You know, we said that we had a 45% increase. Did we not? A 45% increase of traffic on our turnpike. 45% over Memorial Day. Now, if 99% of West Virginians were vaccinated, and I wasn't, and my family wasn't, and everything, would I be urging and dragging them to get them vaccinated or not? Of course I would. Because if 99% of the folks in West Virginia are vaccinated, I still wouldn't take a chance. And on top of that, we had a 45% increase of people coming through West Virginia, and 76% of them are from out of state. Why would I take a chance? Why in the world would I ever take a chance with my family or myself? Absolutely. You got to listen. You got to go get vaccinated. And we're giving away prizes beyond belief. And the prizes to me are secondary to the fact that we're trying to save your life. So go get vaccinated. Absolutely. And we'll all be better for it. God bless each and every one of you. Proud of you. Thank you.